Good afternoon, and thank you for tuning in today. I'm John McCoy, Executive Director of Alumni Relations. On behalf of the University of California, San Francisco Nursing Alumni Association and the School of Nursing, welcome to the 2023 Black History Month panel. We invite you to submit questions by using the Q&A function at the bottom of your Zoom screen. We'll save time towards the end of the program to answer as many questions as time allows. I will now turn it over to our co-host, Adrian Espinosa. Adrian is a 2015 graduate of the MEPIN program and a recipient of the 2020 UCSF Campaign Alumni Award, which is one of the university's highest alumni honors. Adrian is also the current president of the UCSF Nursing Alumni Association. Welcome, Adrian.
Thank you, John, so much. Can everybody hear me? Just checking volume. All right. I want to thank everybody for joining us tonight. It's been a pleasure to serve as our alumni president in this last year and a half, and I'm really excited tonight to have our esteemed guests here to not only acknowledge but celebrate Black History Month. I also have the pleasure of having met these distinguished colleagues and professionals in the nursing community throughout my professional and academic journey. So I'm really excited to welcome them. And to kick off the panel, I wanted to read a quote. Growing up, I really admired Maya Angelou and just all the wonderful wisdom and just, the calmness that she had and just the wisdom that she would always share with the audiences. So I have a little quote from her to kick off this panel. And it reads, "One isn't necessarily born with courage, but one is born with potential. Without courage, we cannot practice any other virtue with consistency. We can't be kind, true, merciful, generous, or honest." By Maya Angelou. Thank you, Maya Angelou. May she rest in peace. I wanted to go ahead and start introducing our panelists. We do have 3 panelists scheduled. Unfortunately, one of our panelists had a little bit of emergency, but might join us in the middle of the conversation, which we're totally hopeful for. In the meantime, we have our two remaining esteemed colleagues here that I'll be introducing. I want to start off here with introducing Monifa Willis, nurse practitioner, who is a practicing nurse practitioner in mental health with over 20 years of experience working in the mental health field in various capacities. I'm going to give a little bit more information on her. Monifa was a marriage and family therapist for 5 years prior to becoming a nurse, where she provided wraparound mental health services to at-risk youth. After becoming a psychiatric registered nurse, she provided adult emergency psychiatric care at San Francisco General Hospital. Once she obtained her master's in nursing as a psychiatric nurse practitioner, she began working at Children's Hospital Oakland, where she provided therapeutic medication management services to youth ages 5 to 21 years old. During her time at Children's Hospital Oakland, she has provided consult liaison service to inpatient hospital and FQHC primary care medical teams. In addition, she founded and currently directs an interdisciplinary team and provides 30-day follow-up service to youth seen in the emergency department for a behavioral crisis. This program is the first of its kind in Alameda County and continues to expand as an intervention to decrease suicidality in youth. Thank you, Professor Willis. And I will also be introducing here Mrs. Kawanda Swafford, who attended UCSF's NP intensive from 2013 to 2015, and where she graduated with honors. Her comprehensive focused on violence exposure in Black American youth. Kawanda was born in Alexandria, Louisiana in 1984. She is the oldest of 2 girls and has 14 aunts and uncles and over 30 cousins. She is the first of her large family to attend college, making her a first-generation graduate. She moved to North Richmond at 14 and later moved to East Oakland. She graduated from Pinole Valley High School in 2002, where she was a part of the Environmental Science Academy. She graduated from San Francisco State University in 2008, where she obtained a Bachelor of Science in Cell, Cellular, and Molecular Biology and a minor in Africana Studies. At SFSU, she made Dean's List for 8 semesters and was awarded several scholarships and grants, which included the National Science and SMART Grant. While attending UCSF, she was granted the Kirsch and Dolores Jones scholarships and was inducted into Sigma Theta Tau. After she graduated with her NP and her master's, Kawanda returned to Oakland, with her roots, and worked at West Oakland Health Council, where she managed and diagnosed diseases in low-income patients with a particular focus on chronic conditions and diseases such as type 2 diabetes, hypertension, CHF, etc. Later, Kawanda became part of the inaugural cohort of the Emergency Medicine NP Fellowship at Stanford Hospital. After completing the fellowship, Kawanda joined the Stanford Emergency Department and Clinical Decision Unit. In the emergency department, she provides emergency services for Stanford's medically complex patients. In the CDU, she manages patients who need further evaluation, consultation, and/or treatment before determining their disposition. Before Kawanda finished her studies and started her career in family, she enjoyed hiking, daily fashion workouts, and riding her motorcycle. As a mother, she still enjoys hiking and working out as much as she can, but is now finding balance doing exciting new family activities like skiing and snowboarding. Along with being health conscious, Kawanda is also passionate about empowering the Black American community and learning the historical American roots of her community. Welcome, Kawanda. Thank you so much to the both of you for being here. And I definitely, like I mentioned and previewed earlier, I have the privilege of having met these wonderful ladies, professionals, colleagues, friends throughout my journey. And I think it's something that I really hold close to my heart because I really admire their work. When I read about them, when I hear about them, or when I hear from a colleague that took a family member to the emergency room and once it had Miss Kawanda as a provider and heard these great, wonderful things, or someone who's had Mrs. Willis as a professor, it just resonates and makes me think, how wonderful it is that we have representation in our community. Not enough representation with nurses of color, but representation. So I'm really happy to have them here today. So feel free to take it away, either one of you, as I begin some of the questions here. I wanted to start off just by asking if you can share a little bit. I shared a little bit about your background, but I want to see how you can maybe intertwine or explain a little bit how your professional journey has intersected with, your history as a Black woman, but also with Black History Month. Anyone?
Yes, I guess I'll kick us off. Hi, everybody. Thank you for tuning in this evening. So how has it intersected? I would start by saying, as a young Black girl passing by Children's Hospital Oakland, going to families' homes, I strongly remember looking over at that hospital and telling my dad, one day I'm going to work there. And it was like a little kid's dream. And at some point, I ended up working there. And I guess I have always approached my privilege in this role as a way to, and I'm going to use this word purposefully, infiltrate the system and sort of bring in my upbringing into the system and my knowledge of the systemic disparities that exist, and sort of use that privilege to change it. And so I found myself in big meetings at Children's Hospital Oakland, challenging those around me. And that's really how I feel I've integrated sort of who I am into the work, and more so pushing us beyond just Black History Month and sort of making folks have to see me every month and every day. Yeah.
Love it. Thank you, Monifa. Kawanda, anything to share with that?
I think, growing up and watching my mother, who was a CNA for all my life, provide, care to elder, folks in nursing homes, and seeing, how hard her role was. And she didn't get paid a lot of money. But it sparked kind of this love for medicine and caring for others, and how much she kind of did on the outside of her nursing home roles, and bringing, things that the nursing home didn't have to, with the little income that we had, bringing extra shampoo and towels and all that type of stuff. So that really sparked my love for caring and patient care. And also, as Monifa said, that, she used to pass by Cho and say, I'm going to work there one day. Well, I ended up there. And when we were living in Richmond, we didn't have any health insurance, and I was very sick for several days, and come to find out I had bacterial meningitis. I went to the county hospital in San Pablo and had a great team of doctors. I was like that case where come in, look at her neck rigidity and, do an LP. And so I got great care at Cho. I was transferred there. But just kind of putting myself, when I take care of patients and patients of color and Black patients, knowing that, the health literacy might not be there, or, the insurance might not be there, but making sure that I really come down and I understand people's reasoning for being there. Oh, my blood pressure was high, but, sometimes we kind of look at things through the lens of, this is not an emergency situation, but what brought that person there? What social issues brought them there? Why did that stay at home so long? So I always bring that to my approach to patient care, and kind of looking at it through that lens of, single Black mothers and, just trying to survive with all the barriers that are against us in society.
Thank you, Kawanda. And for me, just you, both of you touching on the fact, mentioning your family and just, how integral that was and having an experience that reflects and reminds you of having been with them or seeing what they went through. I think that's beautiful, right? It's almost like a full circle moment, thinking back to how that came about and just being able to experience that. So that's amazing. We are fortunately having our third guest, as we mentioned. He is a trooper. I'll let him tell you a little bit, but I do want to introduce him. We have Dr. Austin Nation in the house here. Dr. Austin Nation is a graduate of the University of California, San Francisco School of Nursing, with the emphasis in community health systems. He has been a nurse for over 35 years and currently is an assistant professor in the School of Nursing at California State University, Fullerton. He's actively involved in a number of professional organizations, including Western Institute of Nursing, the Association of Nurses in AIDS Care, and National Black Nurses Association. He has been doing HIV prevention education for over 20 years. Dr. Nation, I'm so glad you're here. Literally was praying that you would be well. I don't know if you want to give just a little background and let people know how resilient you are.
Thank you. No, I just got out of the hospital, literally just got discharged today. I went in for a simple test 2 days ago. I was having some shortness of breath, and I had went on a trip to Australia for the winter break, one of my bucket list trips, as I call it, and haven't been quite right since I got back from that trip and went in for this little CT of my chest, and come to find out I had pulmonary emboli scattered throughout both of my lungs. So needless to say, they said, you're not going home. You're going to have to stay with us a minute. We can't send you home with that. So I had to get some blood thinner going in my system here. So feeling better and didn't want to miss this. So thank you for your patience, and I'm glad the timing worked out that I could be a part of this. It was great hearing just a little bit of what I think the question was coming in.
And I can repeat it, Austin. Yeah, definitely. And if you'd like to share, what we're just mentioning,
sure.
As part of the professional journey that we've had in nursing, that you've had in nursing, how you might feel it intersects with, Black History Month, or your experience growing up as a Black male, as a nurse, and with Black History Month, or just in general with culture.
Yeah. Well, it's interesting because I think about particularly my work when I was up in San Francisco and working with the Bay Area Black nurses. That's probably, I live in Orange County currently, and there is where we call it the 2% club down here. So there are very few. Finding a Black person is few and far between. So, and even in San Francisco, I was very taken back, and during my time there, coming from, Orange County, Los Angeles, down in this area, Southern California, that what I saw up there was a little, were African-Americans primarily in Tenderloin, or as I say, bus drivers. It was hard for me to find professional Black people. And everyone kept telling me at UCSF, don't go to Oakland, don't go to Oakland. It's scary over there. I kind of thought it was like South Central. It had the reputation. So when I finally got the courage I think it was year 3, to go over there because I wanted to partner with some of the community-based agencies, I found in that work with not only some of those community partners, but more importantly, Bay Area Black Nurse Association. And that's where I felt like my work became so much more meaningful in terms of the work that I got to do in the Black community. I mean, really, literally sitting across from people in many of the events that we did, like we really placed ourselves in places and spaces where we can have an impact with people who look like us, and how important it was to sit across from people to be able to, we were doing blood pressure screening, we were screening for cholesterol, we were screening, what else were we doing? I think sometimes we were able to do some vision screening. We were doing a number of things that we were able to do out in the community with people. And we had other partnerships with San Francisco State University. And at these health fair type events, it was nice to be able to give people some basic health information about their well-being. My experiences as a Black man, oftentimes we don't go to the doctor. That's certainly not something in my family that was part of. I remember as a kid going to my mom taking us to those, I think because it was required that she take us for some of those things because they're required for school, or we got sick and she had to take us there. But going to the doctor routinely was not a part of my experience. And so health disparities run in my family, particularly heart disease, diabetes, stroke, those things that are common. And those are the things that I saw out in the community when we were doing some of those screenings. And so we were able to sit across from people and do, obviously a screening can't be a diagnosis, but certainly if you get a person with a really high blood pressure, like we did on many occasions, or high blood sugar, you could begin to talk to them and educate them about their diet and what kind of care are they on. Oftentimes people were on medication they were not taking, didn't understand it, didn't understand the seriousness of it, the implications of it. There's so much of a need, as I saw in our community, for information. And I just wonder why our community was so lacking in that regard. And I think part of it was just the hurriedness of the healthcare system. And I think also maybe health literacy plays a part of that in our community. I'm not sure, but it was nice to be able to have an impact and know that we were able to make a difference in doing the work that we did. And I missed that. The other piece, and I'll just do a plug for, because I did also, as you mentioned in my intro, work with around HIV. And that's another passion project for me, HIV in the Black community. We're disproportionately high, Black women, young Black gay men. I'm concerned. And again, as I have embarked on doing my the research that I've done and talking to young Black gay men was my dissertation project to understand the experiences they were having and what things contributed to those experiences. Again, people not understanding the importance of sexual health, right? The importance of being able to protect themselves. I have to go on my soapbox a minute and say, I think that we do a lousy job in healthcare, nurses, physicians, all of us, in terms of teaching sexual health, talking about sexual health, normalizing sexual health, doing sexual health risk assessments on people, and then being able to impart to them ways that they can play safely and make that a normal thing. It's so stigmatized still in our society, and it puts our people at risk. Not only HIV, but STDs and all kinds of things. Pregnancy, teenage pregnancies, we have that with young Black teens. And again, the power of knowledge and information could go a long way.
Thank you. I almost wanted to jump ahead to another question, because now you got me riled up here and wanting to get it.
That's what I do. That's what I do.
So, but I'm gonna try to go with the flow here. And before we delve more into equity and access, which I think is really important, and some of the topics you brought up, I want to dig a little bit deeper in your hearts and your souls here. And think about growing up, or even now. But what would you say are some cultural or traditions that you might have had growing up that you remember? For Latinos, there's always like, we turn, Mom, I'm gonna have a test. Okay, mijo, let me turn on the candle for you, or let me give you a little blessing, or there was different things as growing up that you notice, like, I still do this. Like, I realized that I still do this. As a kid, my parents instilled this. Now I practice these customs, traditions, and I pass them on to my friends and my community. Can you think of any cultural traditions or things that you carried on throughout your life, your educational journey, professional journey, that maybe you still practice and present day with your family, or even how these sort of help mold you into the person you are today, the Nurse Willis, the Nurse Nation, the Nurse Swafford? Please share. The floor is anybody's.
Anybody want to go first?
I went first last time, so I'm trying to make space for y'all. Go ahead now.
Oh, I just started laughing because I'm old school. I just turned 61 recently, so I'm like, okay, old school. Something called Makir comb, something called witch hazel. I mean, these are like home remedies that you put on. Vicks cured everything. If you put Vicks on, like never any kind. And then of course, here's the thing. These were traditions in our household that you put on this little stuff on every little wound, sore, scab, everything. They don't even make these products anymore. I mean, some of these products anymore, I should say. Makir comb, I can't even know if that even is even a thing still. But I just wonder where my mother and my grandmother got some of these things from. I think about, my grandma talking about growing up as part of us being a slave in her childhood. I mean, that's not that far along in my mind. And how they had to navigate health or lack of health care, and how they dealt with that, and these kinds of what I would call like home remedies. And obviously, you're asking about carrying those traditions on, obviously. No, because as I got educated as a nurse, I graduated at 20 as an RN. It's like, no, educating my family about more appropriate ways to navigate their health issues became a priority for me, because the things that we were using were not okay. Like, you need to go get things checked out, or I can be a free consultant for you on some of these health issues. But some of those remedies that we grew up with, they were not. No, I would know.
Yeah.
Don't do it. Yeah.
Dr. Nation, I still swear by the Vaporu, okay? I don't know.
I know, and thank you for saying that, because I was gonna say, I don't know now. Some of them I hold on to, despite the evidence base out there. No, but I mean, I was gonna chime in that, I mean, less of like the medicine traditions, it's more of just like the spirit. My dad grew up in Oakland, Black Panther. So I grew up with a real resistance, like spirit, a real sort of challenge what's being put in front of you. And I would say that that's been like a tradition of my family. My cousin is the president of ILWU Local 10, that's Longshoremen's over there in Oakland. So, we just come up being people who are going to fight for the people and challenge, period. Challenge systems, challenge what people are trying to feed to you as truth. And if you find it to be true, that's great, accept it, right? But also don't blindly follow the herd. And so that's sort of been, I would say, a family tradition that I've held on to. And sometimes I do challenge the evidence out there, and I'll tell, I sure will use some of my grandma's remedies. And, I guess I'll call it placebo effect, because it sure works for me.
Yeah.
Yeah.
Awesome. I like to talk about kind of like two things. I think that one of the traditions, I was thinking about this, is I think in growing up was activism through the arts, through music, through theater, through paintings, right? Billie Holiday's Strange Fruit, teaching about kind of Jim Crow and kind of all these things that the Black community went through the arts. I think that that's a tradition that the Black American community, is fond of, and kind of is kind of like, that's our superpower. It's to kind of like portray these things through the arts. And also I find that I have some commonality with patients, like, talking about kind of various things in pop culture, music, and paintings, that I can kind of relate with my patients with. And then also kind of some of the things that kind of we need to let go is kind of like this whole tradition of not going to the doctor. And I know what that's rooted in. So I don't have a lot of, I don't put patients down or family members down about that, but it is a problem. And what I do is I invite a lot of my friends and family to call me and ask me questions, and they feel solid. I'm not a nephrologist. I'm not an oncologist. A lot of our family would think that we're kind of like, wear all these hats. But I think just to talk to them and, hey, these are some of the questions. This is what I think. Please don't be afraid. I'm here to support you. And that has come to be very helpful, and kind of like a tradition I'm trying to inset, so people around me can feel safe in the medical system and have someone that they feel is an advocate for them. So I think that is something that, I don't want you guys to not go to the doctor, but here are some tools, and come to me and ask me within reason. I'm not an oncologist, but, I just think that, our family members are more comfortable when they have someone that they can kind of spin things off of and say, what do you think about this? I'm like, that's not going to work. That's not, coming from someone that they can trust and familiar and all of that. And in turn, helps them trust the medical system and their providers that they're dealing with.
I just wanted, go ahead.
No, you go ahead.
Well, I was just going to say, I wanted to highlight something here, like from a mental health perspective. What happened to Blacks here in America was like the ultimate break of attachment, and which ultimately develops your sense of security. And so kind of boiling that down to what Kawanda is saying is ultimately the trust. The trust is broken. And so we are often bridges for trust for our families. And likewise, I'm in mental health. I'm not gonna give you oncology, advice, but at the same time, my family will come to me just to know that there's a trusted person that will translate and be that bridge for them. So yeah,
yes, indeed,
I totally agree. Yeah.
Yeah, and I was going to piggyback in too about for me, the mistrust, the historical mistrust of African Americans in the healthcare system, and the sort of really, if you look at some of the historical atrocities that have happened to us. Obviously, I think Tuskegee being one of the biggest, but we can look at things like Henrietta Lacks. We can look at a number of things that have happened historically with African Americans around not what I would call really abuse at the hands of healthcare providers, and that have stemmed from generations that have been carried down through oral tradition, right? That those things are not that far in our history. I just saw something on the news today about the Tuskegee Airmen. So whenever every time I think about that, I go back to the syphilis thing that was not too long ago, and at least in my history. And I'm thinking to myself, how do you bridge? You're saying bridging that gap of trust of folks, and we know there's that white coat syndrome anyway that we have. All of us, we talk about that in healthcare, but yet with our African American folks, to say, okay, now not only do you have that, but we know that historically, and against the backdrop of racism, that you're accessing a system that doesn't like you, will mistreat you, and so it is laden with all kinds of problems. And so, and I wonder, and as I read, that are some of these health disparities really attributed because we're not there taking care of ourselves, or because of the lack of treatment that's being provided to us, because providers dismiss us in some of the ways that I've seen in my career instead of managing us and informing us. That's what I've seen in my 40-year career. It's actually 40 years now, just by the way. I just took an anniversary.
Hey, congratulations. Yeah, you know, this is, I know you want to get to the next question, but let me just say, because you got me all pumped up.
I'm sitting back here.
Wait a minute, you got me pumped because, you know, okay, James Marion Sims, he was like the godfather of OBGYN, right? There was
we know him.
Right. Okay. Now he did all these experiments on Black women without pain medication, because it was under this, you know, to me, cognitive dissonance that Black women don't feel pain and that this is not impacting them. Now, it is not a coincidence that a healthcare disparity that we have right now, today, in 2023, is that Black women will be offered pain medicine less than other races. So what's happening here? That, to me, we need to start looking at our implicit biases as providers, and really recognize how that historical racist hierarchical behavior and thinking is actually embedded in the way that we're teaching medicine and the way that we're teaching healthcare. And until we acknowledge that, we will continue to see these healthcare disparities. So that.
Yes. Okay, now I'm chiming in. Mo, you got me worked up. You know? You know, no, I actually want to thank you for saying that, because I found myself in practice, providers, you know, referring patients to me for, you know, basic pain management, but a lot of, you know, patients of color, and even, like you said, our biases and thinking, oh, you know, are they addict? Are they whatever? But then, you know, reminding myself, if they're saying they're in pain, they're in pain. I'm gonna go, yes, by the books and get, you know, pain contract. You give me your urine, but as long as you're following these things and we have an agreement, I'm going to do my best to support you and co-manage you with, you know, a pain management clinic if I can as well. But it's so true, because the way we were trained, you know, you kind of automatically just that implicit bias, and even as a person of color, and thank you. Yeah, it's something we need to recheck ourselves constantly, even though, you know, we're in the profession, newbies or we've been in it for a while, we constantly do have to check in with ourselves, because it's something that's very present in the community. So
yeah, okay. So as we say, and we say Black people are drug seeking, right? We coin it as that. So that's the comparison. You put a white person and a Black person with the same kind of pain, and we can be labeled as drug seeking, right? Or we have different tolerance or lack of tolerance, whatever that looks like. And we all know, if you study pain, pain is subjective. It's not for me as a provider to determine your level of pain, for me to treat your pain as you perceive your pain to be. It's not for me. I don't know your pain. I'm not in your body, right? So it's very easy. So yeah, so those, we have to be careful. You're saying it, those biases and that labeling that we do, and and we treat accordingly, and that becomes, or we don't treat accordingly, right?
Right.
Very true. And so now I'm trying to see how to wrap all these great topics in. So, I appreciate how we brought up, the traditions, and you guys mentioned some of them that were family related, and you started intertwining with some of the practice that you have as well. So I do wonder, in the profession, how being, from your community, in the way you were raised, whether it be have been in Oakland and Louisiana, wherever it was, and being now nursing or academia, how do you think that has helped you, like Monifa said, infiltrate in some ways, and for others, working in the emergency medical, I very few colleagues that I've seen that are, so that look like Kawanda when I've been to the ED, and that would make me feel so comfortable to see more Kawandas in the ED when I'm there. Like you're saying, being the OC, Dr. Nation, so how do you feel coming from your background and with your cultural upbringing? How have you been able to use this as a different lens now being in academia or in the profession? I mean, we've been touching on it already, but how, even more so, how do you feel like you've been proactive in it, or how has it, been unraveling in your journey? A loaded question.
Yeah, no, I'm ready. I mean, for me, I think it's breaking barriers. I mean, as I see it, and it's unfortunate, as I say, that it's 2023 that some of these barriers are being broken. When we look at the number of particularly African-American folks who have advanced degrees in nursing, yet we don't see that kind of representation in our faculty and our positions of leadership across the lens. That evidence is there. I teach it. And that distresses me. But the fact that we're there, someone told me I'm going up for tenure now, and it looks like I'll get it down here in the old OC. But somebody said to me anecdotally, they go, you're not going to get it in that dominant university. You're going to end up having to go to an HBCU to get it. And I go, I'll be dang if I do. I'm getting it at my alma mater. And I am, hallelujah. But that's against the odds. Most Black faculty don't last. And it's been challenging to be the only one. But the fact that I'm there, to me, represents an opening for those to come behind. For all the Black kids who come through there's one, right? The barrier has now been broken, and then perhaps for me, as I see it as being in this position in the academy, there's opportunities for generations to come behind us to continue to break down these barriers and to create openings and to create opportunities for those that come behind us. And I'm excited about that. But it doesn't come without a cost. It certainly is not a spirit of love and welcome as I dream of for those of us that are there. And that part, I almost romance this idea of going to the HBCU down here, which is over at Charles Drew University, if you know that, down here in Southern California. Keep thinking maybe I'll be better appreciated there, but and so I don't know. But to me, it's something about giving back where I feel appreciated. And I feel like for me, I am doing research in communities that I'm passionate about, work that's important for me. And that's why I came and got a PhD in the first place, right?
If I may say, before Monifa and Kawanda chime in, I don't know if I ever thanked you, Dr. Nation, my friend Austin, that I met when I was a student at UCSF, because I remember I was going through some challenges, with the imposter syndrome, with, having, for me, Kawanda, I wish I was like you, Han, where I had to, pick things up. For me, sometimes I was like, I had to read it 3-4 times so I can get it, and, going through my challenges, but I was always persistent. But I remember, seeking out support, and I remember I went to Austin just to talk to him one day, and we had lunch, and he was like, yeah, you can come in. Just to have him as a Black man, someone of color that I recognize from my community growing up in East San Jose, and to be able to share and not feel, judged or someone or would belittle me, or just, being at UCSF and knowing that he was a colleague. I mean, reflecting back then and even now, that was so important for me. And it was just, and I've always been thankful for that. And that's why, Dr. Nation, I've always considered you a friend and colleague, even though we might not see each other often. You're part of my journey and my heart, because I feel like I needed that at that time. So like you said, you're doing it now and you were doing it then. So I thank you for that.
Thank you. And let me just say, how important it was for those of us of color. The Latino group had theirs. We had the Black nurses. We had to cling to each other to get through even that journey. I'm not going to be too harsh about my commentary because this is recorded. But when they said they had never had 5 Black people in their PhD program in 100 years at that university, and they were aware of us, I mean, we had to cling to each other. We started support groups for each other. And yeah, it was important for us to be there for each other, right? To get through that experience.
Yes. And I also, you probably don't remember me, but just seeing you on campus meant something as one of two psych mental health nurse practitioners in my cohort, a Black psych mental health nurse practitioner in my cohort. And that sort of segues me to, again, moving into the, mental health lens is where I'll sit from, but ultimately, I hope to push back on the narrative in the mental health community that Black communities don't want service, that we are underserved. In fact, I'm going to push back and I'm going to say, actually, we're overserved. We have a ton of nonprofit organizations and clinics and EPSDT Medi-Cal clinics that are offering individual services. What it is that we're not offering the right services for the people, for Black people. And I'm just being explicit about that. And all these catchy phrases come into play, and I'm gonna call it trauma-informed care and trauma-informed principles. It sounds very good, but what does that actually mean? Are we really meeting Black people where they are and asking them what's actually healing for them? Because it may not be one-on-one individual therapy. And again, going back to, we're still working from a white framed lens of therapy and services. We're still operating from Freud. We're still operating from these systems that honestly, a lot of times did not include Black healing. And so I've been doing some, actually, the fact that you mentioned the school down there in LA, they are doing some really innovative stuff, particularly around training barbers and hair salon operators on how to hear signs of depression and talk about depression while they're in the chair doing hair, doing healing circles with drumming circles instead of groups. Because as Kawanda said, we're rhythmic people. If you go back to us ancestrally, music and singing, that's how we've told our stories. And so it makes sense that that's how we would want to heal, versus sit in this chair across from me, you be 100% vulnerable, and I'm gonna sit here and smile and nod and hold all my cards close to my chest. And yet they wonder why we're not responsive to the care that's constantly being shoved in our faces. So I guess to say, my hope is to challenge that narrative and push us as providers to something different.
Yeah, Kawanda, do you have anything else, or I can?
No, I thought the system, I couldn't hear you guys for a moment. No, I think that Dr. Alston and Monifa summed it up quite well. And we touched on it in the beginning of the session as well.
So tying this in, you guys have mentioned, working within the system, et cetera. What advice can we give some literal advice or tips to our current colleagues, students who might be watching this that are wanting to, go into the roles that we have? Like, what can we do to empower them, to encourage them, and to provide tips on, what can you do to be part of the solution or part of the new outlook that we want to see? Because I think a lot of times, we do hear about stuff and we're about it, but we want to be about it, not just talk about it. So any advice on, how we can approach that, or, things that you've done that maybe worked, or any insights on that?
Just what we said, I think the importance of finding what I would call fellowship and connectedness among each other, how important it is when you're going through this kind of a journey. We need each other. We need each other. We need to lean on each other to survive at this level. I mean, there's just, you can't operate this in a silo and be all by yourself. It doesn't work. It takes a village, truly. The importance of mentors. And I think for me, as I've learned, it's mentors for all occasions. It's not just, I used to have just, a couple mentors, but I found I have mentors that can provide that emotional support. Maybe I have a mentor that is really good for my academic side, somebody who's a content expert. There's mentors for various occasions, a handful of them at least. And the other one that comes to mind right away is the importance for me that has been a lifeline is my cultural or in this case, professional groups around gender. So my men in nursing, my Black nurses, my nurses in AIDS care, I'm in places and spaces with people who play along the same lines of the areas of interest for me. And those are special places that I feel really, really, really connected. And those have been lifelines. And those are also social networks as well. So those are also fun places to be at as well, because those are always fun.
Agreed. We definitely need them. Now, I would like to ask, in looking at your journeys, very powerful journeys that you all had, and I know it's going to be a hard one here, but if you can think of, I mean, I'll let you pick more than one, but if you can think of an influential person that just, you sometimes when you need that, you're having that rough day, you just saw those, 15, 20, 25 patients, you just, somebody suffered a lot, whatever it may be that gives you that tough day, who do you go to? It could be, I'll give you, more than one if you want, but, just think of who do you go to? What is it that reminds you of this person, reminds me of why I'm here, or this person really contributed to my journey? I mean, I think it's really important and great, like we're mentioning, social groups, community groups, having our allies and our peers are very important. But sometimes, I know we have that one person or those two people that really, really are a rock and our stone. And it's okay to get emotional.
I guess when you say in my career, I would say Maud Anderson, which is a retired PA. She was on the board or the panel when I was actually interviewed at Stanford. Long interview, 7, docs, PAs, administrators. So very nerve-wracking. And what she told me afterwards when they selected me, she said, "You guys talk about diversity. You have a candidate in front of us that is fantastic." And she, from that moment, I'm like, she had my back. She saw me, she and throughout the program, she supported me. She welcomed me as as her sister. Just feedback and support through that very tiring year. And having kind of like this imposter syndrome and being with other fellows and, feeling like, okay, feeling like, am I good enough? And she was always that person. No, you are. And she was just a great role model. And just thinking about how she graduated from Stanford PA program, I think maybe in the 70s, where she was the only Black woman. It's like, if I can do it, I know she can do it. And having her in that position and supporting me, truly supporting me and helping me with everything that I needed she's my hero, in that sense. Because sometimes we forget and we don't help people coming up behind us. We don't fully support. And that's what we need in these institutions as well.
Thank you, Kawanda. I think it's so important that we never realize how that one advocate or just that person, like she said, you have this person to be bold enough, not even bold enough to be able to speak the truth and say it, and not think, and to put it in the universe, put it out there, and wow, that's what a blessing. Yeah. I hope is she still living?
We're close in contact. I saw her before I left. And, who knows what that outcome would have been if she didn't speak up in that moment when they were talking about candidates, And so just thank God for her. So, yeah.
Yeah, I'd love to meet her one day. Maybe we can get her at one of our conferences one day and something. So.
I know, she's phenomenal.
Miss Monifa or Miss Josh?
I'll chime in. I'm like, when I say more than one, I'm struggling. What I'll say, I am going to kind of cheat. I'm going to say two. And the reason why is, so
go ahead.
Dr. Joy DeGruy, who wrote Post-Traumatic Slave Syndrome. Now, I don't know her, and that's why I'm going to say two, because I don't know her, but I will never forget the first time I saw her speak. Never. I literally cried, because for the first time in an academic setting, I actually saw how I could apply what I was learning to what the feelings that I was having as a Black person in the United States, or just really as a Black diasporan. And so for me, it was like a light bulb clicked of like, oh, like, because I always struggle, you know, like everybody heard, I was an MFT prior to this, and I couldn't get with it because I was like, I don't believe in this delivery model. I don't believe in how we're moving. And so to me, like seeing her turned that light bulb on. So then to who has given me strength, Dr. Theophia Jackson. She's a Black psychologist over at Children's Hospital Oakland, no longer there, which is also why she is sort of a role model to me. But she's the first Black woman who sat around a table of honestly a bunch of white psychologists, psychiatrists, and just said, wait a minute, like, you're wrong, you know, just straight up, you're wrong. And I mean, she would challenge like right then and there. And I always used to be like, oh, like I never, I never would call someone out like that at a table, but she had such an eloquent way of doing it that I learned a lot from her. And I, you know, I constantly pull from her for strength. She was kind enough as I was a student there to do one-on-ones with me to just help me navigate a lot of the microaggressions that you experience. And to see her be able to walk away from that job and not let a job tie her down. There was something she said to me. She said, as soon, what is it? She said, right before she left, I don't want to mess up her quote, but it was along the lines of, you will break the chains as soon as they realize they cannot control you. And so she was like, do not ever stay. Do not ever let a system make you feel like you need to stay if they are not valuing you. And then she left. And I just remember being like, oh my God, I just started. But at the end of the day, I fully understand that. And so she really gave me the courage to walk away from things that I was probably too afraid to walk away from in fear of, oh no, you know, what's in store for me next. Yeah.
Oh my gosh, Monifa, I literally have like post-traumatic slave syndrome here as one of the theories, because when that theory really explains like, you know, the adaptive behaviors and how we exist in this world and in medicine, and from chattel slavery until all these multi-generational oppressions and how we show up and how we show up to other cultures. And oh my gosh, that's so funny because we were like right on the, like right here, you know, but it really kind of sums up kind of like, you know, it's just the consequences of what we've been through here in this country. So fantastic. She sounds like a great person.
And the learned behavior. Oh, yeah, I know, right?
Yeah. And it's generational, that stuff, right? You guys are going to be jealous if I got the opportunity to meet her, Dr. Joy. I met Dr. Joy. She came to one of our conferences for NBNA. We actually hosted her. So it's such a pleasure to meet her and talk with her. It was soon right after that book came out. So as she spoke at one of our conferences. So it was amazing. So yeah, and for me, I'm like you all. I don't have one. I can't think of one person. I'm thinking of Peter Taylor, who was at UCSF, who was an assistant or associate dean, who was one of the first Black men I had ever met, who was in a position of power and authority, who was such a bedrock when I was really struggling. I think of my colleague Sharon Smith, who was a colleague who spoke just strength into me so many times. Rena Pasick, who was part of my pre-doctoral funding up there when I was there. And then my good therapist, Judy Flor Reynolds, who I say she reached her long arm from Orange County up to San Francisco on more than one meltdown to help me stay in it. So like I said, for me, it has really taken, it's not just one person I can say is that one person is one hero. It really is several that I really owe where I am to. So grateful to.
Awesome.
And, you know, as we're starting to wrap up a little bit here, what you know, we all live busy lives. You all live very busy lives. And, you know we experience in nursing a lot of, COVID, the traumas we went through with that, the burnout we went, through with that. What do you as individuals do in this profession to sort of escape or to reground yourselves or to sort of, Monifa, I know you're gonna have some probably, I always wonder about our professionals that are mental health. How do they cope when they, helping others in that aspect, and how do they even ground themselves in that sense? But, just something that you do on a personal level that you think you'd want to share with us during these times of trying to really continue to be inspired and inspire others and do the work that we do, but also while checking in ourselves and taking care of ourselves. And I mean, I keep thinking, Dr. Nation, take a break. Don't, it's overdo it right now. I can't help it. I'm just like keeping an eye on him. But, but yeah, what can you share? Just something that you think, you would want to tell us as colleagues and as a community, and even colleagues, that might be in the same professions as you, or that, are aspiring to do what you're doing. Just what can we do to check in on ourselves and make sure that, we're okay and that, that we can do this?
Since you called out the mental health, the first thing that came to my mind was grace. Giving myself grace to do what I need to do to just feel well, whatever that looks like. I think that a lot of times we want to prescribe these ideas: go for a walk, go to the beach, read a book, and that just maybe it's laying in my bed. I don't know, I think I roll with how I feel in that moment, and I tell myself that's okay. So giving myself grace to be stressed if I am stressed in that moment and not feel like I actually need to change it sometimes, and just recognizing that that's where I am right now and that's okay. And that this is just a moment in time that will pass, that's honestly how I manage things. I'll check out. People like to ask, what book are you reading? I'm like, nothing heavy. You don't want to know, because it's not some major heavy old book. Yes, I have those moments, but sometimes I just want to check out. I don't want that. I just want to play with my little toddler. I want to, sit in my house and watch some silly TV, laugh a little, and have grace to know that I don't have to be on the grind 24/7. I don't have to be on this constant intellectual hamster wheel. That I could step off, and that's okay.
Thank you. I think a lot of us needed to hear that. Thank you. Anything, Kawanda?
I agree with Monifa. I think whatever it looks like for you to kind of like decompress. For me, I love being out in the fresh air, working out, even when I'm tired. But also just with like the heaviness of society, and anti-Black racism and, police brutality. I like to listen to people that I'm, that are like-minded, and to make me the people, listen to podcasts and like media that makes me feel like I'm not crazy, right? That there is a system, and there's a system called white supremacy, and we live in it, right? And so for me, it's not always that heavy, but sometimes when there's like a lot of things coming at me, it's nice to kind of focus and say, this is a thing. We are not crazy, and so for me, with how heavy society is, I do like to go to podcasts and kind of like Black intellectuals and kind of break this down for me, people who are smarter than me, and also working out and playing with my babies. So, yeah.
Thank you, Kawanda. Very valuable. Dr. Nation, anything to add?
My outlet is just always having a support person, someone I can talk to about everything, that I can just decompress. That's huge for me. For me, talk therapy is so important, and being able to get that stuff out. My other ones are travel. I've done a lot of change of scenery, what I call change of scenery trips, particularly during COVID, where we were doing a lot of stuff virtually. I just need to get out of here. So maybe I can take the computer, and I realize I can take the computer and go anywhere. Even studying, you just take your computer and go anywhere. You don't have to be in your usual spot. Go somewhere different. As long as they got a Wi-Fi signal, you can go somewhere different and get the benefit of being outdoors or just a different scenery that's out there. And then, of course, my other favorite one is I did my my play during COVID. I decided to write my play, Becoming Austin Nation, that I've been performing, and that's been just a huge blast. And it was going to be a book, my life story, and ended up being a performance piece that I've taken to Hollywood and here in Orange County, and now we'll be performing it again here at a local theater in March. And that's really been amazing to get back in touch with a hobby that I had lost touch with, the performing.
Hobbies.
I love going to theater, but to actually perform myself, it's just all this academic stuff, and you don't have time for it. I find I can make time for stuff that's important, and so the joy it gives others, and the feedback that I've gotten in doing that and telling that story, from crack to PhD, one drag queen story is my subtitle. So it's messy, it's about resilience. I tell it all. Yeah.
Right. Awesome.
I love it. I was gonna bring it up, Dr. Nisha. I wasn't sure. I was gonna say you have the arts. I love it. Well, I don't know if we have any questions in the chat, but if anybody later has any questions for our guests, or if you'd like to reach out to them, I'm sure they'd be happy to hear from many of you who might be a little shy right now. But I just want to say that just as I expected and as I knew, with the three of you, I just I'm re-inspired. I really admire the work that all of you are doing, and I hope you never forget that the work you are doing is truly impactful, and you are great leaders in our community. You are representing not just UCSF, but our communities beautifully. And we're far from perfect, but we're perfect for what we're doing in the nursing profession. And I think that I'm very thankful to have you guys as colleagues, and I hope that in the future we can all collaborate, in some ways, and always, remember that we have each other, and we have each other in our thoughts, and that, we all take care of each other too, because I think this profession can definitely burn us out at times and can be a little overwhelming. But when we remind each other of all the family that we built, the village, as we say, that we built, I think it's a beautiful thing. So I just want to thank all of you for taking the time to be here, and just spending a little moment with us and sharing your insight and just a little bit about your life. So any remaining words if you'd like, and if not, I also would like to give a quick plug. Alumni weekend for UCSF will be April 14th and 15th. I will be there hopefully that weekend, God willing. So I'd love to see any of you there, your faces there, if you'd like to join us. You can register. We can give that information later. But yeah, any final thoughts, closing thoughts? Or I know some people have to teach, others have to rest. And
I'm reading the chat. Somebody saying we need a soulful song. I'm like, lift every voice.
I saw that.
Do they want me to sing? Okay, okay.
I actually wanted to raise up what Daniela Vargas put in, the pop-up pregnancy village at the Bayview Opera House that is happening this Saturday. There's some great work coming out of Rafiki Coalition, and Dr. Mo, who's heading that up over there. So if you have time, Saturday at 1, definitely want to highlight what Daniela Vargas put up there to attend that. It's great.
Awesome.
Thank you. I was looking at the wrong Q&A. Now I see the question.
There's some questions and comments here. There's some good. Thank y'all that are out there.
I can only manage so much.
You've done excellent, Adrian. Great job.
Thank you guys. But yeah, so thank you once again for your time, your energy, and just keep doing what you're doing. You guys are amazing.
Thank you. Thank you.
God bless you guys, and thank you everybody for joining us.
Thank you. We are valued. We are needed.
Thank you, everybody.
Yes. Thank you guys so much. God bless.
Be well. Bye-bye.